Hi guys, thank you for coming to my TEDx presentation. I'm Dr. Dhaani, #NewTownGirl. Before moving forward, I would like to discuss some information about myself, my experiences, and the scenarios that are present in India. I completed my graduation and post-graduation in the field of homeopathic medicine and surgery with 2 years of experience as a medical doctor, as a student coordinator, as a social worker, and a volunteer doctor. I came here to pursue my master's degree in public health from University of New Haven. Well, my journey as a student started in 2007 and it was completed in 2017. The long 10 years of my journey, I experienced, I learned, and I grew as a student because I still remember when I was in my final year of undergraduation, I went to different peripheral OPDs to conduct free health checking camps to educate people about the vitality of good health, how to maintain a personal hygiene, and most importantly, how to prevent any outbreak of diseases in the community. That was a time when I started liking preventive and social medicine as a subject, which eventually helped me to get engaged with different kind of non-government organization working for cancer in females and including breast cancer and cervix cancer. I applied in WHO, UNICEF and Doctors Without Borders at that time. Unfortunately, I did not make it, but as of now, I'm doing my master's degree from University of New Haven. I'm looking forward to get a chance to work with them and able to provide my services to the community very soon. When it comes to the scenarios, you will just have to Google it out and you will find a long list of issues that are prevalent in India. But I really want to talk about the things which I am interested in. That is non-availability of sex education among the youth and the adolescent. India is growing at a very fast pace and you will see Indians working everywhere, whether it's medicine, engineering, IT, politics. Kamala Harris is one of the biggest example and I simply adore her. Priyanka Chopra. If you can see a long list of eminent and affluent people, still India is not considered as a developed nation. You know why? This is not just only the one factor, or this is not the only thing which is causing India is not getting developed. Because you know, in India, sex education is not included in the curriculum, and when you Google it out and you will see the statistics, the crime against women, minor children and rape and all related to these offenses, you will find a similar pattern, that non-availability or unawareness about the healthy sexual habits. Sex education is not just about having a good time or menstrual hygiene. It is far beyond that and you have to learn it. And I'm happy that Government of India is working on it and they have started a sex education in their curriculum. But yeah, it is just restricted to an urban area and I'm looking forward so that it gets spread to the entire nation. Now the dream of coming to the United States came true 2 months back. I came here 2 months back and since then I've been reading about the public health and I have a habit of reading statistics and different journals over the internet. You know, then I found here the sex education is included in the curriculum, which is a commendable thing, which shows that public health programs and school health programs are continuously doing their right job. But here comes an eye-opener. Teen pregnancy, rape, and what did you say? Date violence, date rape. These two terms I came to know about this here only, not in India. So why these all things are happening? Then I started Googling out. Then I found different websites. From there onwards, I found that every 73 seconds, one American get assaulted. And after reading more, then I found about the disparities. I got to know about the disparity through my subject and how it is important and what is the importance of disparities among the population. Then I found the girls, young girls are more prone to get raped or sexually assaulted compared to boys. I'm not saying boys are very safe, even boys are also not safe. 1 in 33 boys get assaulted or raped by their known ones or strangers. If we talk about the disparity among the females, according to the age, you will see young girls are more prone to get raped or sexually assaulted or faces such kind of situations. You know, 50% of females get assaulted or get raped by their partners, and 40% of females get raped or assaulted by their known ones. See the difference, you can see. And what about the boys? Boys are also not very safe over here. More than 50% of boys get raped by their known ones, and 20% of boys get raped by the strangers. As I am a university student, I have to understand the scenario which are prevalent in university. So when I started reading, I got to know 13% of total entire university students experience such kind of situation in their entire life. And what about the disparity among the degrees, post-graduation and undergraduation? The postgraduate students, around 6.9% of females and 2.4% of males respectively experience such kind of situation in the university. And what about the undergrads? You will be shocked to know that 24.6% of females and 9.7% of males experience such kind of situation when they are in their university area. So, and one more thing, you know, stalking is also a very offensive crime, you know. 5.8% of female experiences stalking before they enter the university. See, all these things are happening in United States of America, which is called as a developed nation. Now let's talk about the causes. You know, as a medical student, we always say that idiopathy, which means cause not known. Here also the understanding the cause is very difficult, but there are few things which can lead to these kinds of offenses or crimes in the society. One is anger and rage. Second is demonizing other gender. Third, not understanding or the psychological effects are there. So if we talk about the individual effects or individual cause, I would say unavailability of sex education among the population, and the unawareness about the sexual consent. We have to understand this particularly, because if we are in a relationship, the other partner should know about the sex offenses, and if the person is not ready to proceed, how can you move forward with that? It eventually leads to misconduct. So if we are in a, how can we control this? How can we combat this situation? First of all, we have to be more aware. We have to be more vigilant. When you are entering to the university, I know you are kids and you have just completed your school, but you have to be more vigilant. Talk to your parents regarding this. And if you are talking to your parents, talk about what kind of situation you are facing. Later on, just enter your university and just see where you can go and talk related to your situation. There are plenty of, you can find police in the university. These are the situations which you can handle it very easily. And I think University of New Haven is doing it, because I still remember when I entered the university, I got a long survey, 1.5 hour survey about this. And this shows that university is continuously doing this work so that they can make the university campus more protected for their students. And lastly, to conclude, I would like to thank everybody, and specifically the resources which I've used from the internet, my university for providing me and accepting my application so that I came here to study, and TEDx for giving me the opportunity to talk about my situation and the topic which I really want to talk about, and my professors for teaching me about the public health, and lastly, all the audience for bearing me with my interrupted English and my mistakes and my nervousness. And lastly, all these statistics are just a tip of iceberg. The summer's portion is very deep, and you have to understand it by digging inside. And lastly, just talk about your problems to whom you want to talk. Share your problems. And lastly, be aware and just speak, don't sit quiet. And thank you so much, and have a good day.